We are live. Great. Hey, everybody. We're going to get started in just a minute or two here to give people a chance to click in. Let's see. 1 o'clock. Maybe we'll start at like 1:02, John. That sound good with you?
Sure.
All right. Talk. Make sure this is all good. You know, you do this a million times and then you still got to figure out how to do it every time.
Yeah. I use Webinar Jam for webinars, and if I don't do a webinar for 3 or 4 weeks, then I totally forget how the thing works. I have to start over.
I know it. All right. I actually got a few people joining us.
All right.
Great. Hello, everybody. Show us some hearts and some love if you're interested to hear Dr. Jurica. All right.
Do some hearts for ourselves.
Yeah, I know. Hi, heart me.
Mm-hmm.
All right. Well, let's get started. So,
okay.
Right, we'll get rolling. Oh, we got Fiona here. Hi, Andrew and John. Hi, Fiona. Welcome. All right. So now we're going to get started. For those of you that don't know me, my name is Andrew Tisser. I'm an emergency physician, host of the Talk to Me Doc podcast, and a career strategist for early to mid-career physicians who are dissatisfied with their current situation and want to make a change. And I have the honor of being on here with one of my heroes, Dr. John Jurica. John, if you want to introduce yourself.
Oh, maybe. Okay, I will. Let me introduce myself. I'm John Jurica. I'm a family physician. I guess I'm best known maybe as a podcaster. I've been doing the Physician Non-Clinical Careers podcast for 3 years. I have about 165 episodes or so, and they're all about non-clinical careers pretty much. And I'm also one of the admins for a Facebook group, which is pretty large. I think it has 15,000 members now. It's called the Physician Non-Clinical Career Hunters Facebook group. So if you're interested in talking and chatting with others in the group about non-clinical careers, you can go there. We don't allow any promotion in there at all, so I'm not in there selling anything. Just inviting people like Andrew and others to come in and share different things and stimulate conversation. And I think that's basically it. I have some other things that I do that we may get into, but that's who I am, and I've been really excited to come on. Actually, my big claim to fame is I think I was Andrew's second guest on his podcast.
Yes,
that was the high point of my year.
I bet. I'm sure that coming on my new podcast was your high point. Well, John, thank you. Oh, man. But so we're here to talk about non-clinical careers. That's your expertise. And I think really the first question that comes to mind is why even pursue a non-clinical career? I mean, we've spent all this time training to be doctors, and we're perhaps we got some issues in the medical field right now, but why should we even think about it?
I'm going to be really some dark humor here. It's better than blowing your brains out. And I mean that jokingly, obviously, but actually the main reason that people get interested in non-clinical careers to some extent is just burnout. And but there are a lot of people that just want to get into non-clinical careers because they're interesting and different and they're bored or they're whatever. But the thing is, we don't know that much about non-clinical careers, most of us, because we've gone through our training and it's really never brought up. And the reality is there are thousands of jobs in hundreds of fields that only physicians can do that have been trained in med school and residency and so forth. So it would probably be a little unusual for someone like you and me to go into, let's say, college or med school thinking, well, I ultimately want to be the CEO of an insurance company, so I think I'll go to med school. I mean, we just don't think that way. So I think physicians are fantastic. They're great. I consider them to be part of my family, my tribe. We have this shared education and training. And so I think we should be happy. And so if we're unhappy or we just have interests that aren't met by practicing medicine, then we should look at non-clinical jobs because there's a big demand for people to get into that.
I agree. And I think your point is even understated. If you could think of it, it's probably out there. And if you can't think of it, it's probably out there, right? I've said before that the MD or DO degree is the most versatile degree that there is out there, just for the amount of things, the amount of doors it opens for you. So it brings me to the next question. Of course, there's millions of different things you can do, but what are some of the big avenues that you see people pursuing in the non-clinical world?
Well, there's different ways we can kind of parse that and break it down. If I take it from the standpoint of where the most jobs are, there's a lot of opportunities, and I'll just go real high level right now. So first of all, in hospital and health systems, there are thousands of jobs. Hospitals have physician advisors, medical directors, BPMAs, chief medical officers, chief medical information officers, and I can go on. And if you want to get into details, we'll do that. But that's the whole hospital and health system. I usually put that one first because, number one, that's the thing I have the most experience in. I was a chief medical officer and senior VP for a hospital. Number two, it's the biggest piece of the healthcare system. So when a physician moves into a non-clinical job, I think most of the time what I encourage is do something related to medicine or healthcare. I mean, you can go open a hot dog stand or become a salesperson for something, but why not build on what we already know? Well, the biggest chunk of that pie is the money spent on hospitals and health systems and sort of their ancillary services. Second big one, probably is, I don't know for sure, but pharma, medical device, and you can throw in other things, but massive part of the healthcare system. Thousands of jobs for physicians in pharma, everything from clinical research itself to sales to MSLs, which we can talk about. And then there's the whole insurance and payment part of outside of medicine, non-clinical careers, because we know that healthcare has to be paid for. And whether you look at it from the standpoint of jobs related to Medicare directly or all the jobs in the insurance industries around healthcare from utilization management, that's probably one of the most popular first non-clinical careers, getting into case management, that kind of thing. And then there's tons of jobs in medical writing. There's tons of jobs in consulting, both as a freelance or for a large international or national consulting firm, because they all have healthcare departments, and teaching, and et cetera, et cetera. A big one lately I just don't want to not mention is coaching. Physicians are really getting into coaching because it's got all the good parts of physician relationships and so forth without any of the bad parts. But those are the big ones.
Yeah, that's fair. I mean, yeah, we could go on, but I think it's important to talk about, being involved in the hospital system itself, because a lot of physicians, A, aren't interested, and B, don't even know how to get involved. We complain all the time that it's the MBAs and the nurses, they're the leaders here and they make all these policies. But the truth of the matter is, you could get involved if you wanted to. And just a brief example, I know when I started my recent job, I made an appointment with the CEO and the CMO and said, hey, I have interest. How could I get involved? And that quickly led to a medical director opportunity, and, not just like go do these committees for free for years. And that's all it is. But if you are interested in hospital administration, I know many are not, but if you are, there's a lot of opportunity in my experience.
Oh no, it's kind of invisible. We don't see those people that are doing those things, but every service line has a medical director. Every unit almost has a medical director. It doesn't mean they're getting a lot of management activities, but it's a toe in the water, and there's a lot. And then, you got the CMO, which is the most visible of the chief medical officer, which is really kind of over all those medical affairs type activities. But if you look around, you'll see besides that, the CMIO, which is informatics, you've got people doing chief integration officer, chief quality officer, so on and so forth. And those are extremely high paying jobs, by the way, a lot of benefits. And you're really making this huge impact, not only on your peers, but on your patients as a group, on the community. I mean, in my town, the hospitals are the number one employers. They're the biggest employers. And so when I was on that team, I was impacting literally thousands, and I could demonstrate improvements in quality and patient safety. So it's very rewarding too, if you kind of just start thinking about how you can apply your skills as a physician to those kinds of positions.
Yeah, I agree. I think that's a great way to look at it. Some people will be like, well, that's going to the dark side or something like that. But
yeah.
It definitely, I see it as increased reach and increased ability to impact more people. So let's talk about money for a second. You brought up that those are high paying jobs with good benefits. I think a lot of people worry about pursuing a non-clinical opportunity that they're going to have to take a drastic change in their lifestyle. And what do you think about all that? Is that true, or?
Well, it can be, and you probably tell when you're doing some coaching and that, and I've heard this from other coaches, like don't do what I did from them, meaning they actually like just dropped out and started over. But have a plan, and really ideally, if you're going to make a change, you do a lot of research, you put some money aside, you make sure you're financially stable and can take maybe a short hit if there is a hit. But there are a lot of careers where there really is little or no hit and the upside is good. I mean, if you're $1 million, cardiovascular surgeon or whatever, you're not going to get $1 million doing one of the jobs I'm talking about, at least not initially. But as far as being equivalent to a clinical job, particularly if you take some things into consideration, like zero risk of being sued, almost zero risk of being sued. Number two, essentially no call in most of these jobs. I mean, so think of the lifestyle involved. But if you look at it, you're going to even the ones that don't require any special sort of prep are usually going to pay anywhere from $150 to $250 right off the bat. So there might be a little bit of a dip, but see, then over time, you're going to take leadership and you're going to move into positions, even in, let's say, a UM company, insurance company or something, and get, improvements in that. And they usually have, better pensions and profit sharing, all that kind of thing too.
Yeah, that's the thing too, is that generally physician salaries are pretty stagnant, whereas when you work into some of these other companies, there's a lot of vertical growth. So that's something to consider. How do you approach this search? Like someone's like, I've had it. I can't do clinical medicine anymore. I want to pursue a non-clinical career, which, we see on your group and other groups all the time. Like, how do I get out?
Yeah, I know. Everyone comes in like, where do I start?
What do I do? I'll do anything. And, I definitely don't recommend just saying I'll do anything just to get out. I'm of the mind to be running towards something rather than away. Mm-hmm. But how do you get started? I don't know what I want to do. There's a million options. How do I learn? How do I get started? What do you say to those people?
So I tell them to, number one, just kind of take a deep breath and really, do some introspection. Think about, what do they consider a good day for them, whether it's doing something clinical or non-clinical, or even going back. What are the things you like to do in the past when you were an undergrad, and if you went to grad school, or even while you're in med school? What other interests do you have? Are you an introvert, extrovert? I mean, you can actually go ahead and get some personality testing, although it doesn't really help you pick a particular job per se, but at least gives you some insight into what you're really looking for. Maybe even write some things down, like how would your ideal day or week look like a year from now or 5 years from now. But the thing is, you don't really know what's out there. So the next big piece of the beginning part is just getting to know what's out there. There's a lot more resources out there now to find out than there were 5 or 10 years ago even. So you've got the Facebook groups, and you have other Facebook groups besides what I'm talking about that are talking about side gigs, they're talking about remote jobs, they're talking about, you name it. And I think, Andrew, you have a Facebook group where you guys talk about things related to anything.
More targeted towards the early career doc, but we talk about those things as well. And hi there to Gerald for joining us. But yeah, I mean, I agree, John. I think you just got to expose yourself to what's out there. And, you don't have to take the leap to 100% non-clinical right at the beginning either. You could dip your toe in the water, which I think a lot of people don't really know about. They think it's all or nothing.
Well, yeah, it depends on what you get into. There are some like standard approaches that I also talk about, whether it's in the podcast or what have you, in terms of things you can do. First, you just have to kind of get exposed. And there are books written about non-clinical careers. There's actually several out, one by Sylvie Stacy, one by Heidi Moad. There's others out there that give you sort of an overview. It's kind of hard to learn, about those jobs directly from a book. It's almost like an academic exercise. And you can go online and look at different blogs and podcasts. I would, if you have it anywhere narrowed down whatsoever, like, well, I really would want to do something more in the pharma or medical device, not necessarily in the hospital. Find a mentor for each one. So that's one thing. Start your LinkedIn profile and actually start connecting with people on LinkedIn. And so there's other things you can do. Get your resume, start looking at that, and you can start to prep for it. But you won't be able to fully prep until you have a really good understanding of what field you want to get into. You don't mind if I plug somebody else's website, do you, Andrew?
Oh, please do.
Okay, if you go to Sylvie Stacy's Look for Zebras, she has a quiz. She calls it a quiz on there. You answer 50 questions, and at the end, you get one suggestion of what your ideal non-clinical career should be.
Cool.
Now, don't necessarily take that, but it kind of, as you're going through the questions, it makes you think, and then she throws something out there at the end, which kind of aligns based on her experiences. it's free. It makes you think, though. You go, well, maybe I should at least start there and then see what other things are related to that.
Yeah, and I think, using all your resources, like I'll plug you, John, for a second, though. I mean, you've been doing your podcast for a long time, and you've covered so many different careers, and it's nice to hear like a day in the life and what everyone else is doing. Also, I don't think LinkedIn could be overstated. I mean, LinkedIn is the place, right? That's and I feel like a lot of doctors aren't that comfortable with LinkedIn, more so than we used to see. But I think, as far as like the social media world, because it's business related. But everybody knows why you're on LinkedIn. Like people are on LinkedIn for business, which is nice. So, how do you have any tips for how to optimize or maybe how to get started with LinkedIn?
Well, basically, if you're going to be on LinkedIn, first you have to put aside this issue of, well, I really don't want to be on social media. I mean, this is basically an online resume. So if you want to be employed or look for someone else, you go to LinkedIn as a starting point. And there's no sense even doing that unless you're willing to go ahead and put a complete profile up there. So really, at the beginning, it's hard because you don't really know what you want to highlight. But, LinkedIn, you've got to have a photo. You've got to have like a personal statement at the beginning. It could just be what you're doing now. But later on, you put keywords in there about what you're interested in doing and what background you have that might attract jobs in that. And you can be found on LinkedIn without even going to their job board, which is another whole section of LinkedIn where you can look for jobs. But LinkedIn will actually walk you through the steps. You put a complete educational background history in there. You put your complete work history in there, and you just follow it. And they tell you like 3, 4, 5 stars how complete it is. So it's pretty easy. I do have a video on my academy on this, but basically it was just me going in and filling things out, and it's just a screenshot of me doing that. But it's pretty straightforward if you just follow what LinkedIn tells you.
Yeah, it is. And just you will get a steady stream of financial advisors trying to message you. Just try to ignore them unless you really need to. LinkedIn's a great option. The other thing I want to talk about a lot is UM, or utilization management or review, because I feel like a lot of people are just see that as like work from home. It's easy. It's fairly good money. I should just do that. And I do some on the side. I enjoy it. I think it's fulfilling work. But if I did that full time, I certainly could not. Just based on my personality. But I think people see it as like, oh, I got to get into UM because that's the easiest thing to do. Do you suggest starting there, or at least exploring opportunities in UM, or do you really, or is that really personalized as well?
Well, you have to have like the right personality, and you have to have the right frame of mind. Like I did UM as a physician advisor in a hospital for a few years. And really the way we looked at it there was, we're going to just, irritate the doctors and try to get their patients out of the hospital and tell them they couldn't do things. But you shouldn't really look at it that way. You should really look at it like you're trying to educate the physicians about what they need to document and to justify the test they're trying to get. This is usually for the outpatient remote jobs. There's actually like 3 positions in UM. I mean, you can do it in a hospital or health system. So that's where it actually started. Then you can work for one of these independent review organizations or one of these other third party, probably what you're doing, Andrew, it's sort of part-time remote reviews. And then you can work directly for an insurance company. But the people, my guests, have loved it. The ones that did it for several years. I mean, I will say that it seems like because the barrier to entry is low, because pretty much any specialty can do it, even though they tell you they might want an internist, they might want an OB or something. The reality is they train you, and you pretty much, depending on the company, anyone has the skills to do it, unless you have no license and never went to a residency or something, because you need to have some clinical background beyond medical school. And I will say that it's the #1 topic in the Facebook group. I don't know, you may have noticed that, Andrew, when you popped in there. It just comes up all the time because it is a low barrier to entry.
Yeah, and it is a nice, little nice side income stream. And if for the lower paying specialties, full-time UM could be a really big raise on it and a big increase in their lifestyle as well. You don't
mind if I interject here, talking about
Please.
doing something part-time? How about expert witness? That'll pay you like 4 or 5 times your hourly salary. And if you have the stomach or the personality for it, I mean, I actually would like it. If I had a chance, I'd go back and do expert witness. You know, I had to be deposed several times for different reasons. I had no problem being deposed and interacting with attorneys. And you could work for an attorney who's defending physicians, so that would be even better. So that's a part-time one that pays really well.
Yeah, well, that's true. I've dabbled myself, and it's I think that's really interesting. It also, I feel like it helps me clinically with my documentation too, just seeing what they're looking for. Because I mean, you go through a
Yeah.
deposition, and they what
Oh, yeah.
does this eosinophil count mean in regard, like they nickel and dime
No,
everything, but
I
it's
think your
interesting work and very
documentation,
lucrative.
I think your documentation really gets better when you do a few of those
Yeah.
depositions. Okay, now I know why I needed to do that.
Right.
But yeah, so I think I'm trying to think of the other ones besides as being the kind of low barriers and most common. I mean, any remote job, sometimes there's chart reviews that aren't really reviews. There's, you can do chart reviews even on the expert witness side, never have to do a deposition. And I don't know, the other ones that are pretty low barrier would be like medical writing. But the thing is, it takes a while to build up enough pay to significantly cut back clinically to make that work. But it's a very popular option.
Yeah, for sure. And I think, back to the LinkedIn discussion is, once LinkedIn is not very helpful if you're just like, I'm going to put up a profile and then I'm going to get a job. I think if you have a targeted interest and you can target companies and or individuals that are doing the things you want to do, and have a bit of a strategy, I've found lots of great opportunities on LinkedIn and really just like a lot of really cool people. But you have to have an idea going in of what you're looking for. So I think that's a really good place to start.
Yeah, if you can just get that first idea, well, I want to maybe look at or maybe I want to look at, I don't know, CDI, clinical documentation improvement. And then you connect with those people and just ask them questions. People on LinkedIn, oddly, once they connect with you, they usually will answer your questions. You find someone who's been in one of those fields for a few years and say, what's it like? What do you think? Or where should I go to learn how to learn that skill? And it's a great place to learn. I've been surprised by how many people not only have reached out to me, but have just offered free advice when I've asked for it. And actually, I lurk on there quite often to find guests for my podcast. So, and they just say yes. So what the heck?
Oh, that's a fun thing about podcasts, right? It's a low barrier to entry as well. But yeah, I agree. I mean, I think people also like not only just people that work at a company, but executives and higher ups that messaging people. I like your company. I like what you're doing. I wanted to ask you a couple questions. People are usually more than willing to talk to you, and that's a great way to get things started. And hello, Narissa, and welcome to joining. I'm glad you're liking our discussion.
Who is that? Let's see.
Was,
Narissa, hi. One of my recent guests.
Yeah.
So good to see you. I was going to say something about, I had a guest once who was really interested in becoming an MSL, and he was really thinking, how am I going to get into this? A medical science liaison. It's a pharma job. It's kind of an entry-level pharma job. Speaking of Narissa, she's an expert on pharma and medical device companies. But anyway, and so he joined the MSL Society, and he ended up getting the CEO of the MSL Society, or the president, as being his mentor.
Wow.
Through LinkedIn. He just reached out and said, hey, I'm really interested. He ended up mentoring the guy for several months, if not years. And he ended up getting a medical monitor job, though. In the process of pursuing the MSL, he got linked up with some other people in pharma, which is one of the other pharma jobs, medical monitor. And he got his job. He loves it. It's fantastic. And he was someone who had residency only, no clinical, never licensed. And those are two jobs that sometimes you can manage to get if you don't have a license or residency. Yeah. He had a little bit of research background.
A little bit of that's great. Hi, Kayla. Yeah. Welcome to the live here. I think can we talk about the pharmaceutical industry a little bit here? I think when people think that they're going to give up their clinical career, they just think about pharma on the side, and then it's also this like nebulous dark cloud of the enemy for whatever reason. So what kind of opportunities are available in pharmaceuticals, and how would you approach some of that?
Well, let's see. I've looked into pharma. I've had a couple of guests actually. I think Narissa's one, and I think hers is this week, and I have another one coming next week. But so here's what I know, that in pharma, it's kind of broken up into major parts of the industry. So when we think about research, drug research, that's the clinical development piece. And so to get into that, whether it's an entry level or as a, running a study or what have you, I mean, you have to have some background in research or, doing investigations at least as a participant, maybe doing some things when you were in med school or after med school. But that's not what most people think of when they think about going to pharma from a clinical job. Maybe you've been a family doctor, internist, ER, whatever. There's usually the other section. So that would usually be something more in what they call medical affairs. So medical affairs, the way I think of it, is that once a study has been done and the drug is approved, they're really helping to get that drug out there. They're the ones that I think they also interact with the safety group. There's a whole group called Safety and Pharmacovigilance, which is tracking the safety of the drugs while they're being studied and after they've been released. And then there's a whole regulatory section. Most of the people that I talk to are either trying to become an MSL, which is a medical science liaison, who, again, I believe works in the medical affairs division of most pharmaceutical companies. And they're sharing the information about the drugs or the therapeutic classes with physicians. So it involves a lot of travel, but they get to work with what they call key opinion leaders and influencers, and they take information to them. Now, it sounds kind of salesy, but there's zero sales involved. It's all education. They also take information back from the physicians to the company, and then they also interact, within the company with other parts of the team on the medical affairs team, if I remember correctly. And then the medical monitor, when there are studies going on, I guess those would be mostly phase 3 studies where you have investigators out in the field, recruiting patients and so forth. The medical monitor kind of tracks whether all the, I's are dotted and T's are crossed and the investigators are doing what they're supposed to do and tracking the patients appropriately and sharing information and so forth. And then they also help, I think, the safety and pharmacovigilance identify when there might be an issue. So those are kind of how I look at it in the big picture. You can sometimes go directly from clinical to, let's say, the medical affairs as a medical director. You can also go directly from clinical to, I've known people have gone to the safety and pharmacovigilance side. They might have certain requirements that be best just to kind of go through LinkedIn and look at some of the job listings there to see what they require. But if you've had involvement on an IRB, Institutional Review Board, or you've been involved somehow either directly or indirectly with studies and understand the FDA regulations and other things, you might have the opportunity to make that switch fairly easily, depending on where you're looking.
Cool. Yeah, that's great. Great information, John. Yeah, I think LinkedIn's a great place to at least link up with people, learn more. For the MSLs that I have interacted with have been more than willing to chat about what they do and explain how they're not pharma reps.
Yeah.
I think they want to make that distinction.
Oh, it is. It's a big distinction. I've talked to some that said that they're not even allowed to interact with anyone else in the sales department. Now, others, sometimes the MSL will actually teach some of the salespeople if they have questions about the drugs. But I mean, I've heard of some that say, no, it's so separate. They just don't want to get into that issue of being accused by the FDA of, crossing that.
Fair enough. I have a couple questions that were submitted to me before this that I wanted to just make sure we got to before we kind of open it up to everybody. So one question was, how do you express to your clinical leadership that though you signed on for a clinical role, your recent non-clinical experience is turning out to be what you really want to do? So it sounds like someone wants to stay with their organization, but signed up for a clinical job, but wants to really kind of transition towards the non-clinical part of the hospital. I know it's pretty vague, but what do you think?
No, I mean, it's not an unusual situation. I mean, it happens because, again, we're exposed to something. We weren't in this environment other than as trainees, and now we're there, and we're starting to see that there's committees we've been asked to join, and we're getting involved and so forth. It's just a matter of frank discussion. What I hear from a lot of people, a lot of physicians who are thinking about doing a part-time or full-time shift, is they project how they think that those people around them are going to react to their thought process or to their, desire to do that. And we always think, well, our employer is going to look down on that because now they're going to have to replace me or part of my time, and they don't want to lose me, or, and the reality is most good leaders, managers want their employees to grow and to learn, whether it's in their clinical job, but even outside that. And they need leaders. I mean, every hospital and health system needs physician leaders, and sometimes it's hard to find them. So I would have that conversation more as like a curiosity. Like, I've noticed this, I've gone to these meetings, I'm really starting to get interested in this. How can you mentor me to learn more about this? Because I think I might want to do more of it. And most of those people will be fairly open.
Yeah, I think that's a great point. And that goes for, whether that be administrative roles or informatics or physician advisor roles. I think that's all inclusive in what you're saying is, hey, I have this outside interest, like, what could we do? And again, I don't think a lot of the upper level leaders are approached by physicians. When they're approached by physicians, a lot of times it's to complain or to ask for more money or whatever it may be. And I think in that regard too, is if you're trying to negotiate one of these positions, is sometimes your employers are much more willing to negotiate for time rather than money. I know for my medical directorship job, they offered me a stipend, and I said, well, can I just work one less shift? And they're like, oh yeah, sure, no problem. Mm-hmm. And that means more to me than the extra X amount of dollars per year. So that's kind of an important thing too, is buying out time rather than getting more salary, especially when it comes to the hospital system. I don't know if you've seen that as well, but that's been my experience.
No, in fact, you can run into a problem if you don't do that, particularly if you have an employment situation, you're expected to work so many hours a week, let's say in an office or something. You can end up doing, 1.5 full-time jobs, if you're not careful. But most hospitals and health systems know that they've got to do that kind of a swap. And so, because you don't want your docs to burn out. So if they're going to really give us meaningful 10 hours a week, a medical directorship or physician advisor, then we need to carve out 10 hours a week. And maybe the payment's the same, it's just a wash. The other tricky thing I would do, I mean, it's not underhanded, but is like, if you are dealing with, let's say, a director of a department, like quality department or a nursing director or something, if you can help solve their problem, they're really not going to mind you working more on this particular issue or learning more about how to get into management, because sometimes the only person that can really solve a management problem is a physician. So you can become quite key, and then they'll actually invite you in to do more.
Exactly. And I think what you said before too is don't project how you think they're going to react onto your employer, because you have no idea, right? That's all something within yourself, rather than, because the worst thing they could say is no, right?
Yeah, right. Like, I don't think that's going to happen because we can't afford to replace you, blah, blah, blah. But so many times there is that flexibility that just asking, well, they'll be able to accommodate. And there are ways they can backfill the clinical, or maybe, the volumes are going down anyway. We don't need you to be full-time, and we'd like you to do this other stuff.
Or in enabling you to work a little less versus hiring a whole another person to do that job may be cost benefit for them as well. Right. The other big question I had was, how do you get involved in utilization with very little clinical experience as a new graduate? Is it possible, and how do you do it? I want to just, before you answer, I want to say that I've done it. So, okay. A lot of them ask for 5 years of clinical experience, but a lot of them are not hard and fast rules, and some of them count residency. And so it can be done. But how would you answer that question, John?
No, I think I would say the same thing. Would you look on the job listings, try and find something where they're saying, 5 years clinical experience preferred. The word's preferred. That means if they get desperate, they'll take pretty much anybody that has at least has a background where they can express, understanding those concepts. Again, usually they give you like a 4 to 6 week training. A lot of the UM side, you're just implementing a standard algorithm of what is approved or not approved, depending on the diagnoses and the documentation, things like that, depending exactly what you get into. So there's some there. But yeah, look for that and see if you can find the ones that they're willing to at least get you on an interview.
Yeah, I agree. I mean, when I was looking for part-time UM positions, I just emailed everybody, and a couple of them stuck. So, I I want to open this up to questions for those that are listening right now. But before we do that, I just wanted to talk a little bit about the Non-Clinical Career Academy and what you offer there, and a really cool offer that you're bringing to the listeners right now. So could you talk about your academy for those that don't know about it?
Yeah. So since I started blogging and then podcasting in the last 4 or 5 years, I've tried to come up with different ways that I can help physicians, because we all kind of learn differently and prefer different platforms. Believe it or not, there's still people that have never listened to a single podcast. So it kind of seems crazy to a podcaster, but it's very true.
Yep.
So like I'm involved in the Facebook group, and I'm actually involved with an online forum. But I started, basically what I want to do is have lectures for physicians to sit down and look at in their free time, basically. So I started putting together these different lectures that were introducing different non-clinical careers and approach that. And there's like a video about where to find salary for physicians working in the hospital setting, and then there's maybe a course on remote jobs. And so I started building these up, and I thought, well, I don't want to really sell these piecemeal, so I created a membership site. So now I put new content in there every month. People come in, physicians come in, and they just join as a member. They pay a monthly fee, and then they have access to everything, and they can kind of go in whatever order they want. They can focus on the things that they are most interested in. I would not say it's 100% comprehensive. Obviously, there's only 17 courses. I mean, it's a lot to go through, but I'm always adding more. That's the thing about a membership site, is I can keep adding new content every week, every month, what have you. So I usually put something new in there about every month. So it's out there. It's called the Non-Clinical Career Academy membership. And what I've done for, just last month or so, I thought, well, how can I have someone go in there and get a taste of it? So I started offering this $1 for the first month. So you can go in there for $1 and look at every course in there. If you can go through them all in a month, more power to you. But if you want to continue at your leisure and sort through and kind of learn from it over time, which most people don't have all that much time, then you can decide whether you want to stick it, with it and convert to the monthly fee that's in place at that moment. So yeah, I think Andrew has a link to it. And then you just have to make sure when you're on that landing page or sales page where it describes everything and lists all the courses, and you decide, if you want to at least get the trial, then you put your information. You have to use the coupon code TRIAL, TRIAL. And I'm going to do that probably for about another month, and then I'm going to close it completely and then relaunch it again later. I think I'm going to it's been an evergreen for a while where people have just come as they wanted to, but I'm going to actually have it where there's more cohorts of people going through it. So I'm going to do that, close it down, and then open it again next year after the first of the year. But now you can get in for $1 to just check it out.
Cool. Yeah, it's great. I've watched a lot of those videos, and they're really, really comprehensive in their subject matter. So check it out. You can go to andrewtisserdo.com/nonclinical, as you see at the bottom of the screen, and put in that trial. You can't even get a cup of coffee for $1 anymore. So, check out all this great stuff John has to offer. So for those of you that are listening right now, we just want to open it up for questions. Both of us are here to answer whatever you'd like. So open to questions. I will monitor the comments. And we had a couple of thank yous and a couple of greats and yeses thus far. So thank you for joining us for those, adding your thanks to the chat. So are you going to do a course on bluegrass guitar one of these days, or what?
I've been up here recording myself because I promised like 100 episodes ago that I might put me on the guitar as my intro and outro, but I just am not to that point. But I do play bluegrass guitar sometimes, poorly. But it's fun. It's a hobby. So that's why I thought I put the guitar, but that's actually not the guitar I play. So I have like 6 guitars. And most guitar players, they just have a bunch of guitars they never play, and they always have their one favorite.
That'd be pretty cool with the intro and outro, though. That would be neat. All right, we got a couple of hearts on there. Thank you. No questions here. Just a big fan. Thanks for all you do, from Dr. Gerald Diaz. Thanks, Gerald. Thanks for joining.
Awesome. Thanks, Gerald.
All right. Yeah, I poorly play the bluegrass banjo. And we didn't.
Do you?
Yeah.
Oh, my Lord. You
I
know,
know.
mandolin players, banjo players are worth $1 million. You know, you got 15 guitar players. You can't find a single banjo player. Oh, you're in trouble, Andrew. I'm going to
I
track
know.
you down.
It's too bad. When we used to live in Chicago, we could have jammed, so we didn't know each other then. Oh well.
I wonder if we can
Um,
do that on Zoom or not.
I wonder how it would kind of turn out. Might be
I don't
cool.
know. But we'll figure something out.
Yeah, I agree. That'll be the next one. All right, everybody. So we're going to close this down. Remember, this is going to live on YouTube and my personal page and my group. So if you have later questions, you could post them in there and we'll get John to throw us some answers at some point. Thanks for everyone who joined. And again, thanks, John, for coming. Check out the Non-Clinical Careers Academy and have a great day, man.
Okay. It's been great being here. Take care.
Take care.